When it comes to coronavirus and children, anxiety takes over. The government has come out with a list of guidelines to manage COVID-19 among children. The DGHS, or the Director General of Health Services, has strictly warned against the use of Remdesivir in kids. Well, for mild symptoms, steroids are harmful, says the DGHS, in asymptomatic and mild cases of infection. Antimicrobials are not recommended for therapy or for prophylaxis. Rational use of HRCT imaging has been recommended for mild infection of paracetamol. 10 to 15 mg per kilogram per dose can be given every 4 to 6 hours for fever along with throat soothing agents. Warm saline gargles in older children and adolescents have been recommended for cough. In moderate infection, guidelines recommend initiating immediate oxygen therapy. Corticosteroids are not required in all children with moderate illness. They may be administered in rapidly progressive disease, and anticoagulants may also be indicated. For severe infection, and this among children in acute respiratory distress syndrome, and if this develops, necessary management should be initiated. Antimicrobials can be administered if there is evidence or strong suspicion of superadded bacterial infection. Children may need organ support in case of organ dysfunction. A 6-minute walk test is recommended for children above the age of 12 under the supervision of parents or guardians to assess cardiopulmonary exercise tolerance and is used to unmask hypoxia. Place a pulse oximeter to the kid's finger and ask the child to walk in the confines of the room for about 6 minutes or so. For asymptomatic infection among children, guidelines recommend no specific medication and promoted COVID-appropriate behavior such as wearing of a mask, strict hand hygiene and physical distancing, and also has suggested giving nutritious diet.